Good evening, Kat.
Good evening, Shelley. How are you going today?
I'm very good, and I'm very excited about our guest this evening. Who have we got?
So am I. We have Dr. Raquel Butler from Integrated Veterinary Therapeutics. Welcome to the podcast, Raquel. Thank you for joining us.
Thank you. Yeah, I'm super excited to be here chatting to you guys.
Yeah, no, we're very excited because you're an incredibly interesting professional. And it goes with our theme that we try to have on a lot on Canter therapy is getting to understand horse health and soundness issues, and you are definitely the place to go to find out a lot of information about that.
Thank you. Yeah, I'm looking forward to chatting to you.
Yeah, we were just talking before. The first time I came across you was at Equitana in 2022, listening to an absolutely brilliant talk on scars. Never did you really improved my understanding of that and allowed me to, be able to see them and understand what they were. And I think, Kat, you saw Raquel's other presentation?
Yeah, I was going to say, it was quite funny that you went to that one and I went to the other one. So I saw your talk at Equitana on rehab, and I know your work quite well, and always sort of wanted to get to a dissection with you and Sharon May-Davis when you were doing those. And I really enjoyed your chat at Equitana on rehab. You really broke it down and made it super simple to understand, which is that's my favorite way to have information.
Yeah, definitely.
Yeah, simple is good.
Okay, yeah. Raquel, now can you tell us, how did you get into horses? How long have you been into horses?
Well, my mum sat me on my first horse when I was 1. Yeah. And that was pretty much the end of my life. I decided from that point that horses were it. But mum kind of said, "Oh, you can't really have a career with horses. You won't like make any money, or there's not enough in it," kind of thing. And so then I was like, "Okay, well, I'll be a vet."
Excellent solution.
Yeah. So yeah, I think I just loved them from that point on.
So you went and did a veterinary degree. Where did you study? When was that?
So that was 2004 was when I graduated from Melbourne University. So yeah, I've been a vet for 20 years this year.
Wow.
Which is crazy.
That's awesome.
Yeah.
So what did you do after you finished as a vet?
Yeah, so I studied vet, and during my vet degree I met Dr Ian Bidstrup, who's a veterinary chiro, and I spent, I think it was just a day or something with him, and I saw him examine horses, and he could just watch them walk and pick all of these things, and I thought I'd had really difficult horses, like horses that would take off, that would buck, that would rear, that would lay down when they were girthed. And, I always just thought it was a behavioural problem, and I had a massage therapist, but I never really understood much else. And seeing him, I was like, okay, that's what I want to do. So I kind of knew that in vet school, and then, became a vet, did the work as a vet for a few years. I went overseas, did the travel thing, and then came back and thought, okay, what can I do now? And then I found equine muscle release therapy, and then from there that was it, like lots of other courses, and then the grad diploma in Animal Biomechanical Medicine, so osteopathy, chiro and rehab. I studied craniosacral, what else, Masterson method, taping. I've taught taping. I then met Sharon May-Davis, and she introduced me to the world of dissections, and she also said I think you'd make a good teacher. So then I went down that path, and I've studied a grad cert in learning and teaching in higher ed, and a cert 4, and done a Bachelor of Science in honours. Now I'm an equinology equine body worker as well.
Yeah, wow. And you also work for the uni? You also
I was.
You were?
Yeah, so I was working for Charles Sturt University, teaching them Bachelor of Equine Science for the last, I think, 6 years or something. But I wanted to have a bit more of an impact in the industry, and so I've gone back into my own business now, and I've started my own online courses, and back just like I never stopped treating horses. So I figured, well, if I never stopped really doing it, then I probably should keep doing it.
Maybe you enjoy it a little bit.
Yeah, exactly.
So can you tell us a little bit about your business? I think it's Veterinary Integrated Therapy?
Integrated Veterinary Therapeutics.
Got it around the wrong way, sorry. Yeah. Can you tell us a little bit about this?
The longest business name in history.
Good one. But it means something.
Yeah, so Integrated Veterinary Therapeutics. So it's I guess it encompasses everything that I do. Like, obviously I came up with the name of it just when I was going to do body work. So back when I first kind of started, actually it was one of my good friends who came up with the name. And yeah, it encompasses, I treat horses with chiropractic, osteopathy, rehabilitation. I do like prolotherapy, which is an injectable sort of therapy.
Oh, I have heard of that, yeah.
Yeah, and then I also have just started my online courses in I call them equine functional posture. So I've just started that, as well as doing a little bit of teaching for the university and teaching for equinology. So yeah, it kind of encompasses all of that.
I think you're also a saddle fitter as well, aren't you? You also do saddle.
I studied. I did do the ASFA course, but I didn't become like completely certified in it because it wasn't for me. But I can definitely recognise.
Yeah, it just gave you the bit of the background to also help.
Yeah.
Sorry, Kat, you were going to say?
I was just going to say, I have so many questions of where we could go next. So can you tell me what, and I'm going to forget the phrase you just used, functional...
Oh, equine functional posture?
Yeah, functional posture. What's functional posture to you?
Yeah, so I think functional posture to me is a horse that is able to work like, you know, they might have limitations, so they might have physical issues, constraints, maybe they've had old injuries or scars or something like that, but they're functioning, and they're functioning like in an optimal posture. So, you know, I think that there's a lot of horses that are not posturally balanced, and I think it leads to a lot of problems, both behaviourally and physically. And so to me, if we can kind of get them in a posture where they're balanced, they have what we call postural stability, and they're able to move in their optimal, like what's optimal for them, then, you know, you just see such a change in the horses. Like, it's quite, yeah, it's always blows me away how little we actually need to do to help them be functional. But then when we shift the body in that way, how it kind of goes, oh, this is a much better way to be. Like, I like it here. And then everything else kind of starts to line up.
Yeah. Can I ask you, because everyone says posture, but I'm pretty sure there's lots of people out there that when you say posture, they're not 100% sure. Can you explain what is posture? And then what is functional posture? And then we might want to get into some things what impact posture, but tell me what basic posture is to start with.
Yeah, so I guess the way that I would describe, like, there's what I call static posture and dynamic posture. Yep. So there's like the static posture, which is just how your horse stands in the paddock, you know, like do they stand square? Do they have one leg always out? Do they rest one leg all the time? Is their head high? Is their head low? Like, is their belly dropped and their back dipped, or, you know, like, what is their kind of outline and their leg positions relative to their body? And does that look comfortable and, you know, like healthy and happy? And then there's dynamic posture, which is the way that they then carry that posture into motion. So, you know, again, like, what's their head and neck position when they're moving in the different gaits, and do they lift themselves up or do they drop themselves down? Like, what does their back do when they're moving? So does it lift or does it drop? You know, do their legs go out behind them or do their legs come underneath them, or do they come underneath them too much? So, yeah, it's kind of just really, I guess, the overarching description of it is like, what does the outline look like? Like, where are the legs positioned relative to the body, both moving and statically?
So what's functional posture? What's a functional posture mean?
So to me, a functional posture would be one where the horse is able to be relaxed, you know, so there's no brace. They don't look like they're holding themselves in a certain position. Yep. They look like, for a better description, happy. So, you know, like often their facial expression will be quite soft. You know, their ears will often be forward, their mouth is soft, and they look like it's easy to move in that posture or to stand in that posture. And the limbs are both supporting when they're on the ground, and when they're off the ground, they're in a good alignment, like they're not dragging and stuff
or
like
being
that.
Flung outside of the center of mass.
Yeah. And then that, you know, they're kind of lifting through their thoracic sling, which is the connection of the forelimbs onto the rib cage. Like, they're lifting through there, and then the head and neck just goes into a really nice position, like without any restraints on the head and neck. It just sits in a lovely position, and then the hind end comes through from there, and the tail is relaxed and it's flowing, and then there's flow through the spine, and it kind of looks like it just is all one connected.
Yeah, it's not compartmentalized or offset.
Yeah, like no bit looks like it's sticking out. Everything looks like it belongs together, and it just looks easy and relaxed. Like that's what I think we should be aiming for.
I think it's what we're all aiming for. I think that it gets challenging trying to achieve it.
Really hard, yeah. Yeah.
Okay, so can you tell us a little bit about your own horses and sort of what you do with them and that sort of stuff?
Yeah, so I have 4 at the moment. 2 are just retired thoroughbreds off the track. So, you know, they're happy just being in the paddock and being looked after in that way. They've kind of had their journeys, and, you know, for soundness issues, they've ended up just the paddock ornaments. And then I have Jelly, so he's my current, I have 2 current projects, so Jelly and Ellie, Ellie May. Jelly and Ellie actually don't like each other because they're always competing for my attention. But Jelly is a horse that's got a muscle disorder, so I suspect that he has a myofibrillar myopathy, which is like a different form of, like, people know about PSSM, like polysaccharide storage myopathy, and this is like another kind of variant of that they've discovered. And so he was a client's horse, and then he was quite challenging to manage, and I had him at my place on holidays for a couple of times and was really helping him with his functional posture. And so they decided to give him to me because I was able to help him, like, in a way that they didn't have the skills, and also it gave him a life instead of, like, because he was an eventer and he couldn't really do that anymore with his stuff. So yeah, and I've just started, like, or not just started, but I ride him bridleless a bit, and he's a pretty happy dude now. And Ellie May is 4 and she's unbroken. She has also a number of physical challenges from a few injuries when she was younger. And so I'm just kind of getting her you know, starting to work. She's quite a pleasure. And yeah, I want to break, like, I don't want to say break her in. I want to kind of start her myself if I can within reason. And yeah, that's kind of a new challenge for me, because I've worked with rehabbing older horses, but doing it with a younger horse is very, very different, as I'm sure you both know.
Oh, absolutely.
All right. I got some very good questions that I want to ask now. So okay, so you got all this experience, you can see so much. Raquel, is there a sound horse out there?
I guess it depends what you define as sound.
Oh, I love it. Okay, so give us your definitions.
I think we've got to talk about functionally sound for, you know, for whatever the requirement is of the horse. Do you know what I mean? Like, the horse might be sound, like, okay, like if we use Jelly as an example.
Yeah.
He is sound for me to do groundwork and the amount of riding that I do, but to put him back, say, in a full dressage work or eventing, he might not hold that soundness.
Yeah.
So I think it's soundness relative to the job that you want them to do. And I think all horses have their issues, just like all people have their stuff. And then it's figuring out how we work with those, you know, like, and that may not always mean we can do with them what we want to do. It might mean that we have to adjust their job a little bit and, you know, work within their constraints, because I think that horses are super forgiving and very giving. And I think a lot of horses are doing things that perhaps their bodies are not fully capable of, but they will, that's just their nature most of the time until they really feel like they've got no other option but to say no.
Yeah. No, they got a lot of compensation that they can go through before they come to the end of their tether. Yeah. Or that thing that I learned recently, because being a horse trainer, what I do, helping people with their horses, it didn't take me long to realize that a horse that wasn't responding to training, or a difficult horse, they all ended up having something wrong with them.
Yeah.
Right? So if someone presents me a horse and they're struggling to learn something, like, and with good training that is what you call very surgical training, doing something very small to begin with, and you watch their learning and you track it, is that if they struggle to learn, or they're inconsistent, or they struggle to progress, that's a massive red flag. And I have 100% track record of having any difficult horse I've come across in my life having something wrong with them.
Yeah, thank you.
So that's why I'm very passionate about, I feel like what I am is the triage nurse in emergency. People come in with behavioural problems, and very quickly I can work out, look, you've got like a clarity, like an understanding expectation issue, as well as just some, you know, getting cool with stuff and getting confident with doing it. That is a big chunk of the problems that I see, but there is this massive amount of soundness issues that you've got a horse that's just struggling to actually feel comfortable doing what it's been asked to do. And that whole thing that I'll jump up and down till the cows come home. Horses with soundness problems don't have to be hopping lame.
No.
Because it depends where the lameness is and how the horse is compensating. Yeah. And in fact, can you tell me this? Is this kind of correct that I've, you know, because what I do then, I've got to make sure that I can triage well. So I've got to be able to pick it, right? And the thing was, sometimes it's the soundness or lameness issues that are bilateral or diagonal or whatever that the horse cannot compensate. So therefore, when a horse cannot compensate, they don't show the shortened stride and the asymmetrical stride. So they're actually harder to see. So the horses that are struggling the most are actually harder to see they're not right. Is that correct? Have I done my study okay?
No, 100%. Like, they are the masters of compensation.
Yeah.
And there's more than often, is that the saying? More often than not, that's the saying. More often than not, there's more than one issue going on. You know, like, as vets, we like to compartmentalize and say, like, well, it's lame in its right carpus, its right knee, but like, why is it lame in its right knee? Because there's probably something that happened that led to that. And like, I had one recently. She was in my functional posture course, and obviously she's worked a lot to improve her horse's posture, and she's known for a long time that he wasn't quite right, but no one would listen to her. So all the vets said, no, he's fine. And then eventually she got a vet to listen to her, and we talked about it in the course and stuff. And so she got his feet x-rayed, and like, he's got really bad arthritis, like really, the vet said the worst she's ever seen. And the reason that it wasn't obvious was exactly what you just said. It was bilateral, and his posture was so bad that like, or not bad, but like, he's a heavy horse, and he was really heavy in his forehand. So he was short in front anyway because of his posture. And then she improved his posture. And then it became more obvious that he was struggling because he now was using his front legs more because he had the motion. And so like, that's just an example where it can be really difficult to pick up because he had poor posture and he was bilaterally lame.
Yeah, wow.
And he was behaving like there was no behavioural issues really. Like, he wasn't.
Yeah, bless him.
No, because she was very kind to him. So the way she was managing him, she wouldn't push him and stuff. So therefore he didn't feel the need to show it behaviourally. So yeah, definitely. And also the other thing that you said was, how horses display stuff behavioural in 100% of the time, which is mostly my experience as well, unless they've had a really bad mental trauma.
Yeah.
But, so Jelly used to take off on the lunge. So he would just all of a sudden, like, if you put him into Canter, he would then basically bolt on the lunge. And when he was not present, you couldn't tell him to whoa, you couldn't stop him. He just completely lost his balance and he was freaking out. Yeah. And it took a long time to part of him stopping doing that was just getting him balanced, getting him physically balanced, and then teaching him to self-regulate. And that I could see, that I was showing him I could recognize that and helping him learn how to deal with that. Because he was probably getting sudden pains, like who knows what it felt like for him. And then he'd lose his balance, and then he'd get really anxious, and then it would just perpetuate from there because he'd slip, and still happens occasionally. But he's now able to stay present through the whole thing, like if it does happen. So that's like an example of his misbehavior that was a physical balance issue.
Yeah, and I don't think people realize that horses are grossly affected by a sense of balance.
Oh, they hate it.
Well, that's their getaway. That's their survival thing. When you feel like they're going to fall over.
Yeah, they got to protect the brainstem.
Incredibly alarming for them.
Yeah, I had a 2-year-old. I think he was 18 months old at the time, and he was a big warm blood, and he injured himself. He was a client's horse, and he injured his nerve in the front leg. So he lost all of the stability in his front leg. And initially we were like, oh, he's so difficult to handle, and he's so full of himself, and he's just being a 2-year-old colt. And then we realized that the times when he was being really difficult was when he was tired and he was losing control of that forelimb. And what's the worst thing for a colt? To feel imbalanced, it's it's a survival, massive survival mechanism.
And they just have to push through and try and save themselves.
Yeah, and so once we recognise that, we would know, okay, he's getting tired, let's put him away. And that made such a difference. We stopped, we stopped harassing him for being pushy. Yeah. And just saying okay, he's getting pushy, he's tired, that's enough for him tonight. And I think that's really hard for people to do because it's but he's being pushy. We need to tell him that's not okay. And it's like, well, he can't actually hold himself.
Well, it's just going to make him
worse. Yeah, then they explode, then they rear, and then they fall over, or something bad happens.
Yeah. Yeah, so poorly understood.
Yeah.
I have a question. Do you reckon I can remember what it was?
I'll let you go because I have 63.
You want to go your one, Shelley, because I will come back to mine.
I do. Man, I have so many questions.
I have so many too, and then you tell me a story, and I'm like, I can't remember.
I want to bring it back to what you do and what you offer, because you are you're developing some really amazing courses that I've even looked into myself, and I want to tell you why I'm so interested in what you do and why I think what you do is really unique but very important. And I'm going to explain, and kind of for the podcast I want to explain, because I have a personal experience with injury, right, and rehab with myself.
Yeah, same.
And I know the power of it. I've had a number of hospitals. I managed to break my back twice, right? Just my little spinous processes and things like that, so nothing major. But as I am getting older, and my and any activity change, a big change for me was when I started training and doing clinics and everything full time, and I was traveling around a lot, sitting on aeroplanes and stuff like that, and it changed all, of course, my posture and what I've been doing. And so having to always adjust what I'm doing with what my lifestyle is, number one. Okay, that was important. Number two, with my injuries, I actually have a disease. It's called Graves' disease. It's hyperactive thyroid gland, right? Yeah. Now, whenever I have an attack and it comes out of remission, what it does, one of my first signs is terrible back pain, because it targets my muscles. So it's like a metabolic thing that changes your muscles, right? That stops them being stronger. And of course, I get terrible, terrible back pain.
Yeah.
Anyway, at the end of last year, my Graves' disease decided to come back, and it made my back so bad. I was crippled, right? Anyway, if you look at my back on an X-ray machine, you'll have a heart attack, right? It is like you wouldn't buy me if I was a horse at all. It would be a bullet, right? However, what I get so inspired by is when I do go through back rehab, which is what I've been doing for the last couple of months, and how effective that is at managing my pain, right? And every time I damn well do it, and every time I do my Pilates and everything, everyone should do goddamn Pilates, because it, just on the fact that it's good for you, but also it makes you really understand horses when you're training them and what they're going through. But yeah, it's just amazing how I started. I started off with some flexibility and some mobility, and then started bringing the strength in, and it just is amazing what it does to the body. And when you actually look at the exercises that I do, they're actually nothing that they only take me 30 minutes per day, plus I do a lot of walking and motion and stuff like that. But that's why I'm so inspired that we just stick our horses in paddocks that they can't move very much. So it reminds me of me stuck on an airplane or in front of my desk, right? And then we pull them out and we want them to do something pretty extreme that they're not fit, all these things. And then they end up with an injury, and then everyone puts their hands in the air and think that they can't do anything with their horse anymore, which is where I want to turn to you and the power of what you do. So I want you to tell us a little bit more about your courses and what you teach people, because what you teach people is basically what I've been going through with my rehab, but in a horse-centric way.
Yeah. Yeah, and it's simple.
Yeah.
There's lots of exercises that they learn, but it's simple. So like that's an equine functional posture course, and in level 1, I walk people through assessment, because they've got to be able to recognize if their horse is uncomfortable first, and like have a baseline as well to work from, so they can start to like learn how to palpate and assess posture, and learn what their horse's telltale signs are. And then when it changes, that they can actually recognize, oh yeah, that was, because some people, we don't always see things, you might not notice that they always rest that hind leg until you actually start to observe. So we talk about observing, and then we talk about physical assessment, and then we go into like what stuff can you change in your environment to help set up a better posture, because yes, environment is a problem for our domestic horses.
So Raquel, can you just give us some examples of simple things people can do?
So just looking at a comfortable feeding height.
Yeah.
That sets the horse up, that it looks like it puts its legs in a better position is probably the simplest way. Like it, you know, that maybe it was standing with its front legs right underneath, and then you find a feeding position, which is often, you know, it might be a little bit raised or it might be quite raised depending on the horse, but you find a position where A, they're happy to stay there, and B, their legs look like they're in a better position relative to their body.
Yeah.
So that's like more like square, like one leg in each corner.
Yes. Yeah. So more one leg in each corner, and that, you know, maybe the back posture starts to change a little bit, or the head and neck starts to relax. And like, even when we got to, so that's in like week 3 of my course, like people were posting photos really quickly about, oh my God, like my horse has not stood square for years. And, you know, its posture has changed in the last like 3 days since I've changed the feeding position. And then they'd be like, oh, I don't know about this. So then I help them, like people post their photos, and then we discuss and try other things. And so that's the environmental kind of aspect of it. And then the next one we do like spinal mobilizations, because just simple, and I have very specific ways that I do them. And then we do postural, what we call dance moves. So they're just simple steps. So like stepping the leg, one step, getting the shoulder mobility, one step, like one pole, one hind limb step, but in balance with correct biomechanics and real awareness of like how the horse is able to physically do it, how they're mentally coping with it, and what's actually going on with the body. So it's so simple, but it's actually really challenging to get that one step correct. Like, and then we kind of integrate that, and we do what we call, like, we start postural dancing. So, you know, we start to like incorporate that in what I call therapeutic circles. And so there's a bit of like, you can then take that into movement. Which is the whole aim, is to, you know, get the horse able to hold their posture in movement. But it's actually harder than you think initially, because they have these strong patterns set up of the way that they've moved for however long, like that could be years and years. And so we have to repattern their postural programs, which to establish a new kind of pattern can take a good 6 weeks. But if you get it correct, like if the brain has recognized the movement properly, it's amazing how the horse can quickly pick it up the next time. Like, it's like, you know, being clear and consistent and knowing exactly what you want. And I'll often if I'm in a situation with the horse, I will show the horse. So then the horse's like nervous system and body can recognize the movement, and then that helps the owner, because the horse has already gone, oh, that's way more better to like move like that. I didn't even know that was possible for me.
Is that because their brains, like the brain actually switches off a certain area because it doesn't want it to be moved to protect it, or that it's painful, so it just switches on and off, and then you're tapping back into it and reminding it to function?
So like I had a back injury last year as well, like my disc went, and so I've been working with that now for the whole year, and like I still don't have full like normal function in my right leg. And so I've kind of gone through that whole rehab process myself, and like having had nerve pain and having had muscles that just switch off. Like I don't always have pain, but I get pain pretty much every morning, but like, and I feel like I can't, takes me a while.
I know where you're at. Been there.
learning how to like activate my muscles and then feeling the difference of that. And then, you know, even though it's really difficult because my muscles like, I'm like out of here, you know, like it's floppy basically. And so like my glutes floppy. And so then like going through that myself, just like what you said, I now understand when I work with Jelly and other people's horses, like what it looks like for a muscle to switch on and what it means for that muscle to switch on, and like what it means for the brain, like and I've done a bit of Feldenkrais, which is like a real awareness of movement, and it's like super aware. And I think, you know, applying that to the horses is really important because it's like really making those connections in the body. And I just have to share this. I was away for 10 days, right? And then Jelly's had months of not much work. And then I did, how long have we been here for? A week and a half maybe of work before I went away for 10 days. And he's not in like full work. He's not fit. But I worked him today, so he's had 10 days off. And I worked him today, and you'd think, you know, that how would he hold that? I only did it for a week and a half, right? But we've done 12 months of postural work. And today he worked still, there was an improvement on last time, even though it was 10 days ago.
Yeah, very cool.
And the same with my young horse. Like she also had improvement, even though it was 10 days ago. And it's like, that just says to me, A, we don't need to work them all the time, but B, if we do things in a really clear way and we're really posturally aware and we stay within their boundaries, which are often quite small, then we see the benefits regardless of how long they've had between work, if they haven't done any crazy stuff. And I mean, that just blows me away because that's not how we think about training horses.
No, I totally agree. And it does, when you just set the body up right, the body is an amazing healing thing, organism.
Yeah, it wants to be in balance. That's the safest place to be.
Yeah. And when you just strengthen that, stretch that, release that, help that, get your brain circuit back activated up, the brain reconnecting with it again, is that it can come back to life. And I just think those skills are so vital, you know, like I really think all people know how to just say pick out a hoof, but I wish that they all, everyone just had
I just want to stop you there because not everyone can pick out a hoof.
Sorry,
very well.
I'll take that. I'll wind that back. But people will probably say, oh, pick my horse's feet out before I ride it. But wouldn't it be lovely if this was just more understood? And so that's why I think you being able to put it into a course, Raquel, and walk people through that with, you know, you've got this vast experience of it, giving them eyes, giving them assessments, giving them program, and how you introduce bit by bit. That really is fantastic. That's fantastic. It really is that whole concept of integrated veterinary medicine. Okay, Kat, you've got your questions yet?
I was going to say that this should be normal. This should be what should be taught to kids when they're at Pony Club. This is what should be taught the whole way through our education with horses system so that horses get the best for them.
Yeah, and it's just creating that awareness. Like I think if we had that awareness from a young age, like we just have such a better connection with our horses and such a better understanding of when they're finding something challenging. And like I was writing a webinar today, and I wrote that riding should be riding should be a privilege, you know, so like rather than an assumption like that we get a horse to ride it, it should be like if we set the horse up the right way, then it's a privilege to ride them because they feel amazing, like, and they really enjoy it because they feel like they can express themselves, they can communicate with you, they're in balance. You're not constantly having to nag them to stay in balance, and it's an absolute pleasure. But we do kind of take it for granted that we have horses to be ridden. And, you know, I think we have to, if that's our expectation, then we have to look at supporting them a lot more to be able to withstand being ridden, and also to be able to have a longevity to be a riding horse, because a lot of the ways that, you know, we are riding them, we don't even recognise that we're compromising them biomechanically.
Yeah, that's so true.
I'm going to come back to the question I had that I remembered. What do you do when you go to the vet for an assessment or get someone out to look at your horse and you don't get any answers? You're not sort of getting to the bottom of the problems that you're having.
Yeah, this is a question that we've had long discussions about in the level 2 of the functional posture course. Like, we've had numerous discussions because obviously I'm training people to see more, and so they're recognizing
things that maybe vets can't see.
Yeah, and they're picking them up way earlier than when they're getting to a lameness. You know, like they're picking up that their horse is just not quite right, and it's very challenging because, you know, I play a bit of devil's advocate because I also understand the vet's position.
Yeah,
I understand what their knowledge is and their limitations are, and the pressures that you feel as a vet to be right, and to be in control. I know this sounds weird, but like to be in control of the situation. Like, you know, we're kind of taught like we are the ones that need to know, and we should know.
And you're kind of at the end of the road, like
and the buck stops.
There's no one above you.
Yeah, and you know, we don't often have that option to refer. So if we don't know, then it can be difficult to say that to somebody as well. So, I mean, my biggest thing that I say is just if you feel that there's something not right in your horse, there's something not right in your horse. Like, you know your horse the best.
Validate them.
Person. You're your horse's advocate. And I think I did a post on it recently about being your horse's sunrise, I think I said. But like, you know, and I think there's a few equine vets out there who have now owned horses, and so they don't necessarily understand that the relationship that people have with their horses, and the way they do communicate with us. Like, you know, they really do. They tell us a lot. So I think you just got to keep searching if you can't find the person that is helping you. So don't think that you're wrong, because you're not. And also don't tell the vet what to do. So, you know, just make it a question and kind of make it their idea. And, you know, kind of discuss it in a way like, oh, I'm learning about this or that, and I was just wondering about this, and yeah, maybe, you know, maybe even say like, oh, maybe there's nothing wrong with their feet or their, you know, but can you just humour me and take the x-ray anyway? You know, I'm going to pay a bill, like, and I mean, there's vets out there who will do it because they're like, oh, well, it's money in my pocket, but, you know, like, just seeing if they will humour you, or asking, or, you know, even asking them, you know, I guess you can't even ask them why they won't do it because, you know, that's their professional opinion, but like trying to make it their idea and just trying to say, can you just basically humour me and take the x-ray?
I think for my clients, I say, well, can you ask your vet to take some baseline x-rays so that we know what we have to refer back to in the future? Yeah,
like, you can kind of say that because then you're coming from the trimmer perspective, so that gives the clients a bit of an out from them saying it. So if they can kind of put it back on another professional and say that it's a baseline, like just say, I just want that baseline.
But even for my own horses, I do that on hocks and fetlock and knees and all of it. I'm like, if I have a baseline, then I know what I'm sort of looking at in the future.
Yeah, definitely. Yeah. Yeah.
We did a podcast a little while ago with our friend Dr. Heidi McGrath, and we kind of came up with a bit of a theory about why one of the many reasons for the not quite right horse missing or not being able to pull up a diagnosis. And she brought up a really good fact that, you know, a lot of people call up the vet and they get the vet to come out to the property, and, you know, you've got an hour, 40 minutes, whatever you've locked in, and it's kind of not going through that full lameness workup of actually the visual observation. So all the equipment there that you can tick away. And Whitey pointed that out, and I think it was very true, you know, and trying to spell home to people, you know, like, it's best if you can take that horse to the vet, leave it there for the day or whatever, so the vet can come and go from it, and really go over the horse with do a full lameness workup, not just this bitsy stuff where you're hoping and praying that it's something common and then it's not.
Yeah, but I think the other aspect that some vets have forgotten about is palpation.
Yeah.
And even Sue Dyson, like, I was listening to her webinar on lumbosacral disease, and you know, like, she talked about, like, the diagnostics are very valuable, but it has to really go hand in hand with our ability to palpate. And the amount of things that I've found that I would never ever have found as a vet, you know, like pectoral tears and groin injuries and hip spasms and stuff that, like, the other week I had a young horse, and she said, I treated the horse a couple of weeks ago, and I know this horse has had some pretty bad injuries, and she said, oh, she's still a bit lame. So straight away I'm like, oh, well, we've got to rule out the foot. So but we got her out, and I said, oh, she's pretty tight in her pec here, I think she strained it. So I treated it and the lameness went. Now, as a vet, there's no way I could have done that. No way. A, I couldn't have found it, and B, I couldn't have confirmed it. So, you know, I found it because I know her history, and I've had my hands on her many times. But then the fact that I could actually do something about it and see that it improved, you know, like, a vet could do the distal limb, so it's also, there's a lot of soundness issues that they're limited in.
Yeah, true.
And if you went looking for a lameness in the distal limb, you'd probably find one anyway.
Yeah, exactly. And that's the other thing, is that we've got to be careful of interpreting things like x-rays, and you know, that we need to prove that that's the primary cause, and that can be quite difficult. Like I'm doing a webinar this week, tomorrow night, on kissing spine. Like, it's a free webinar, but, you know, and working on that today, like, that's a really controversial one, because
it is.
You can have radiographic changes, and it may or may not be clinical, and it can be really difficult to figure out even if it is clinical, is that the primary problem or not?
I got kissing spine in my neck.
I was going to say, you probably have kissing spine with
but it's in my back. They're all like, but, you know, I don't have any neck pain yet.
There you go. But you have back pain, right?
Yeah, I'm managed, but it's all part of the whole dealing with my postural function.
Yes.
Oh, this has been a super talk, Raquel. Hey, how do people find out, like, they might have listened to this and been quite interested, how can people find out more about you and your courses and what you offer?
So I have the Facebook page, Integrated Veterinary Therapeutics. I'm not sure how easy my web page is to find, because I kind of set it up myself. But I do have a web page. I can give you guys a link to the course.
Yeah, is it linked to your Facebook page?
No.
Raquel, you got to have it all.
I'm really terrible at all the other stuff, like the business aspect and the marketing and all that. But I'll give you guys the link, and I should have it on my Facebook page.
Well, because I got in trouble. I just had a really lovely lady go through my stuff, like about me, and she was just like, "You have links everywhere," and she goes like, "I went here, and then you got a link for that, and I went there, and you got a link for that." And she goes, there's no place where all your links are in the one spot. She goes, how are people meant to find you?
Yeah.
And it was like, yeah, that makes sense. So there you go. Sort that out.
Yeah, I'll send you the link to my webpage
Thank you.
and the courses that are coming up that are starting within the next 2 weeks, like week or two.
Okay. All right.
Awesome.
Yeah.
Right. We could
Thank you so much for your time.
Yeah, we better stop asking you questions. We've been going for a while. Yeah, this has been an absolutely enjoyable chat. It's really just cemented that whole idea for me that an integrated approach is best.
Yeah.
Okay, and that's what integrated means. It's like integrated kind of functional medicine in people, where you're looking at it from a number of eyes, from lots of different silos of knowledge, that you're looking at the dimensions of it, which is so powerful. And yeah, looking at the importance of things which you don't, the horse's posture and how they're moving, and that has to become, like, ideally it would be lovely if that became part of routine, or how we thought about horses, because we sit on their backs. It's not normal.
We expect them to carry us. We're all crooked. We put that on them, that even if they're fitting perfectly, you know, they're still a dynamic being. We put stuff on their feet. We don't have as much movement as they should have.
That's right. They're standing still, which is not natural. So that
bits in their mouth, it can affect their tongue and the way they move, and
their hind limbs.
A lot of stuff.
Yeah. And we wonder why they get a little bit difficult sometimes, or they become unsound when really, you know, like by just
set them up better posturally.
Yeah, small things, you can have a happier horse, a sounder horse, and a horse that lives, you know, it's got more longevity in it. But also all those things keep you healthy too. Anyway, it just ticks all the boxes.
No, definitely. Thanks so much for having me. I really.
No worries. Thank you. Thanks for talking.
Thank you.
See ya.
Thank
Bye.
you.